thing I will remember the most about this experience is the initial stress of living through a pandemic that I never had the experience, watching the fear in my staff for their safety, the safety of their families, and just the stress of trying to make sure that we were doing everything possible to keep our patients safe and our staff safe. Initially, we didn't get that many patients, and when we really started seeing the community being affected and started seeing other counties actually needing our help and needing to send patients to us, and started to see our ICUs impacted with the number of patients, that's when I realized this is really serious. I fear for the staff, I fear for my family, I fear for the community. We celebrate when a patient comes in and they're able to go home, but it's still heart-wrenching to see patients come in and not be able to go home. And also not to be able to allow the family members at the bedside like we normally do, because it's really important for family to be involved in care. I think if people saw what I could see, I think they absolutely would understand better. You get these updates of the number of cases, number of positives, number of deaths, and there's a lot of question of those numbers. But I think if they actually took a day to walk a hospital and actually see the impact even one patient has, I think they would understand more that this is a really serious situation. We've had patients that really we did not think we were going to have a good outcome, and they really turned around. And the hospital, we all celebrated. We do what's called a code happy when a patient with COVID leaves the hospital, and the hallways were lined with staff, and we were just celebrating. And then to hear that person's experience and how much we impacted them and changed their life and saved their life, that really, that's really touching, really moving. And then on the opposite side, we have people who it's really hard to be able to have the family say their goodbyes to somebody that didn't make it. I absolutely see benefits to what I do. And I see it every day when I walk through the halls or when I talk to my friends that are, worried about their safety in the community. So every day I feel like there are definite benefits to what we do. As a nurse, my goal is to provide and to serve and to care for people, and understanding how important and the impact that what I do every day has on the staff, the hospitals, the patients, their family members, and the community gives me the strength to do this every day.